A very warm welcome to this online summit for European region member organization representatives. It's a pleasure to see engagements from across the region on a topic that is rapidly becoming central to the future of healthcare in Europe, the European health data space. As many of you will know, the EHDS is a landmark European Union regulation adopted in 2025, designed to create a common framework for secure sharing, access, and reuse of electronic health data across member states. It aims to empower individuals with greater control over their health data, while also enabling that data to be used securely and responsibly for healthcare delivery, research, innovation, and policymaking. So in practical terms, this means a future where patients can access and share their health information across borders, and where physiotherapists and other health professionals can deliver more informed and coordinated care, and where data can drive improvements in prevention, rehabilitation, and health system performance. For our profession, the implications are significant. The EHDS is not just a digital or technical initiative. It is a transformation in how health information flows, how care is delivered, and how our role as physiotherapists is understood with increasingly data-driven health systems. That is why this summit is so timely. And today we aim to do three things. First, to build a shared understanding of what the EHDS is and what it will mean in practice over the coming years, as implementation gradually unfolds across Europe. Second, to explore what this means specifically for physiotherapy organizations, both in terms of opportunities and responsibilities. And third, to learn from real-world experiences. I am particularly pleased that we will include concrete examples from the Netherlands and the United Kingdom. These cases will illustrate how different health systems are already engaging with digital health data, interoperability, and patient access, offering valuable insights into what EHDS implementation might look like on the ground. This summit is also an opportunity for dialogue. The EHDS will only succeed if health professionals, including physiotherapists, are actively involved in shaping how it is implemented. Your perspectives, questions, and experiences are essential. I encourage you to engage actively, to think about what this means for your national context, and to consider how we, as a European physiotherapy community, can contribute to and benefit from this transformation. As the chair of the Advocacy and EU Matters Working Group, it is my pleasure to hand over to Adérito. Thank you for being here, and I look forward to a rich and forward-looking discussion.
Thank you, Tim. So as Tim just mentioned, the EHDS is a major challenge also for physiotherapy. Today, we are not having just a webinar. I believe we are in a working session. We know from the Europe Region Survey on Digital Physiotherapy Records and Data Access that countries are starting from very different positions. In many countries, standardized patient summaries are not yet a routine. Official digital physiotherapy records are not yet widespread. Access to other providers' clinical information is often only partial, and legal and technical barriers remain substantial. Drawing on country experiences, and today we will have the Netherlands and the UK experiences, the session will move beyond presentations to structured peer exchange, helping those that are participating in the summit to identify what can be advanced nationally and what may require a coordinated Europe region action, particularly in relation to representation, interoperability, terminology, patient summaries, and access to clinical relevant data. So thank you for being here. I will hand over to Marijn, Senior Advisor for Digitalization and Data Exchange at the Royal Dutch Society for Physiotherapy, to deliver his presentation. Thank you.
Thank you so much, Adérito. Good morning, everyone. I will share some insights and perhaps opportunities and Dutch examples of our experiences with the AHDS. Of course, I think many of you already know most of the impact of the AHDS because there were earlier some presentations about this, so I won't go into detail. One big question for us was, will the AHDS impact all of physiotherapy in the Netherlands, considering part of it is private, part of it is publicly funded, and the ministry confirmed the EHS impacts all regulated healthcare professionals. So because of physiotherapists are regulated, all physiotherapy falls under EHS. So this was a big question for us. And it's important because we don't want a gap between private or public funded physiotherapy. This might be interesting for you, or a question how your national organization or ministry. One short recap for the impact of the ATS both in primary and the secondary use. Here you can see some examples how it impacts the physiotherapy and in your country, in every country in the EU, of course. And of course, we're going to a more regulated, more mandatory scheme where our software vendors, our EHR vendors, our health records vendors will have to self-certificate. And well, there's a big question of how will we make the transition, of course. So these tech upgrades, they're a big part of EHS, of course. We're moving towards more structured data, hopefully to lead to more efficiency and patient empowerment, but also places a significant burden on the EHR vendors. So what are we talking about? Well, the patient summary is the main part of the ATS which affects physiotherapy. So all physiotherapists will have to comply to the same data standard for the patient summary. And some of the physiotherapists, of course, working in the hospitals, for example, will also have to be using or be part of a patient discharge report. So what opportunities were there for national physiotherapy associations? For us, we wanted to contact our Ministry of Health. We wanted to collaborate to share in the standard setting. There are work groups in the EU already working on several data formats, standards which we will use in the EU-wide, and every member states has a say in. So it's important if you want to influence this process and its outcomes. You talk of we all can go to our Ministry of Health and perhaps make sure our voice is heard in between all the other associations who might also be contacting our ministries. And we had a survey which items were most important for us. And of course, treatment goals, diagnosis, intervention, and outcomes are items which are important for us. So perhaps these could be a part of the patient summary, which could be standardized. I already mentioned physiotherapy in national law. So the HDS should impact all physiotherapy, not just allied, or I should say publicly or privately funded. And perhaps also interesting for you, in the Netherlands, there are opportunities for subsidies or projects working together with other organizations, government organizations, and making sure the transition is met and healthcare providers and EHR vendors get up to date and make the necessary tech updates. And perhaps we could have a role in this. Maybe there can be campaigns to inform, educate, or train physiotherapists. So I'll give you some examples of what we are working on right now. It's a large program for data availability. It's a topic where in all of the Netherlands, in our government sees a big opportunity. There are some sub-sectors within the healthcare sector which are more on the front line. We've been investing in EHR standards and making it possible to share data easily. For us, we wanted to start which the GP referrals and reporting back to the GPs and making it possible for patients to access physiotherapy health records. We couldn't do this by ourselves. We had to work together with other occupations, other national occupation organizations such as the dietitians, occupational therapists, or speech therapists, because they are the same software vendors. The same EHR vendors which work for the physiotherapists also work for the speech therapists. So we wanted to work together so we could collaborate and make guidelines, make specifications, and develop infrastructure together with them, so we could improve the data availability and optimize receiving and sending messages. It's been a very tough time organizing this because, of course, all of us are very strong-minded about what we should manage first, what goals we should achieve, and but we managed together with the 7 occupations to develop a plan and achieve 8 million grant from the national authority. This gives us an opportunity to not only develop standards, but also help our physiotherapists in applying them and learning how to use them. Last but not least, we are working on a big project. It's an important topic in the Netherlands. That there's one shared healthcare language. Some years ago, we chose Németh as our national, let's say, code system for healthcare information. And this year, together with 6 other sectors, we are working on items for treatment and diagnosis on several different subsectors within the healthcare in the Netherlands. Physiotherapy among them. We're working on treatment items, which we want to develop and choose Németh items for. So later this year, it might become available and we could share this with you. And last, maybe you've heard of this, but we've already been working for several years on uniform physiotherapy data sets for quality improvement, which we have funded ourselves. Of course, there were many challenges. I think most important of this is the collaboration part. It takes a lot of patience, lobbying skills, collaborative work to work with strong-minded individuals about and develop a plan which everyone can stand for and everyone wants to work on. Working together, creating trust, and working together with the government for such a large program is important. It's also very tough. We need incentives for our vendors. Just asking your EHR vendor to comply to new ICT standards won't be enough. Usually it won't deliver any customer value. So it's a big risk for one HR vendor to be the first to implement an ICT standard. So it's like a tragedy of the commons. We have to work together. Ask a lot of HR vendors to start together at the same time. And when they all start together, there's a shared risk, and it's not one HR vendor on the front line risking and making a financial bet. Of course, we had a little bit of funding. It's not enough for the HR vendor to cover all the costs, but it helps to get started. And of course, some countries have already some experience with this. The adoption is crucial. If you don't make sure that our physiotherapists learn how to use it, if the HR vendors make an UX design, which is very hard to work with, if it takes more time, it won't be used. So it must be easier, it must be better, and we have to tell the story to the physiotherapist. It will make better healthcare. I think we can work together. Perhaps we can make a list of contact persons who are working on this topic so we can share our experiences, maybe even share some results. Maybe we could share already data formats which we're working on. And when the EU patient summary becomes available, maybe we can have a look at each text and how it looks compared to the EU patient summary mandatory data format. Maybe there are already some reference sets in use. I saw that the questionnaire or the survey which we did that some countries already have some reference sets available. And finally, maybe we could share if there are projects which we start or which we are working on, so we know what is being done in all countries, or if there's some work already being done. Perhaps interesting, we're already working on the public GitHub page. For those of you familiar, it's an ICT platform for developing software. If you like, I want to share the presentation later. You can look it up. And this is API specs. This is how we develop a way of uniform and secure data disclosure from our patient EHR vendors to the patient EHR apps, which we have in the Netherlands. Of course, it will be in Dutch. Part of it is in English, but some browsers can translate this very easily. So perhaps this might be useful. All right. Maybe there are more collaboration opportunities which are EHR vendors. We can collaborate ourselves, of course, as an association, and maybe we can unite and get more bargaining power to our EHR vendors, and push back a little on lock-in tactics or monopolies that might be forming when there is a new standard becoming mandatory. Maybe we should be mindful of price hikes, which might become a thing. Maybe not. Maybe there's a lot of competition between the EHR vendors, but I don't know how the situation is in each country. In the Netherlands, we have over 20 companies, but only 3 or 4 are in the lead and have the main part of the market. And of course, maybe we can work together with the vendor companies. If they implement these standards in a very unfriendly way, they won't be used. So we must be sure to help them and make sure that the physiotherapy gets their software, which is very easy to use. To sum it up, perhaps the standards and the unity of language and advocacy are themes and there are opportunities which you could use. You could contact your Ministry of Health, maybe work together with the EHR vendors, maybe work together with other occupations which are the same occupations that your HR vendor has for their customers. Might be interesting to look how your physiotherapy HR vendor market is working. Maybe we can have some opportunities in helping our physiotherapists in building and training, so they know how to use the new data formats and perhaps a new way of using the healthcare information. Thank you so much.
Thank you, Marijn. So we will have an opportunity to pose questions to both speakers. So I now invite Euan McComiskie, which he is a health informatics lead at the Chartered Society of Physiotherapy. And
thank you, Adérito. Good morning, everybody. My name's Euan. I am a physiotherapist and I work for the Chartered Society of Physiotherapy in the UK. I'm also joined on the call this morning by my colleague Jackie Lidgard, who will be here to help with answering some questions later as well. We want to speak to you about bridging the digital and data gap in physiotherapy in the UK and what lessons we can share with our European colleagues. So in 2025, the National Health Service published their 10-year plan for healthcare in England. There are 3 shifts that they are seeking to deliver: illness to prevention, hospital to community, and analogue to digital. In the document, there is a huge focus on digital, which is fantastic, with the word being mentioned 120 times. Technology being mentioned 164 times, data 183 times. And to put those numbers in perspective, physiotherapy is mentioned only 4 times. And when we narrow the focus to allied health professions, including physiotherapy, occupational therapy, dietetics, radiography, amongst others, the NHS wanted us to deliver digitally ready, digitally mature, and data-enabled services in the digital framework in 2019. In 2022, they stated that data was critical to the transformation of care and that over the next 5 years, the digital framework must be implemented. They've only got 1 year left to achieve that, and time is running out. So what we see now really is, despite the policy push to improve, we really have a data void in physiotherapy in the UK. That was demonstrated in a 2022 survey led by the CSP for the Community Rehab Alliance. We surveyed services who provide community rehabilitation and asked about their data habits. Nearly half of those services reporting not submitting any data to any local, national, or regional database. Among the most common reasons for people not submitting data were that they didn't think that they had to, a lack of time, a lack of resources to collect and submit, and not having the right equipment. And for those that did submit, not everyone got information back from those databases. 1 in 5 reported never receiving anything back that they could use to inform their services. The other thing that we see is a competency gap, and we know that from a study that was completed by Tak et al. In 2022, and they demonstrated that nearly 20% self-reported their competence to be poor or very poor in data management. Nearly 40% reporting poor or very poor competence in meta competencies, which included leadership, change management, and governance, amongst other things, and just over 40% reporting poor or very poor competence in records, assessments, and plans. It's important to note that the workforce do want to use digital at work, but the gaps in their competence make it difficult to do so. But poor data compliance is not the fault of the workforce. The same study by Tak et al. Found that only 24% reported that the systems that they use did all that they wanted them to do. 60% reported systems actually getting in the way of their clinical processes and procedures, and only 40% knew the processes to request changes to those systems. Our systems are not working for us. There are significant gaps in digital and data practice for physiotherapists in the UK, and I suspect we're not alone in that. There are gaps in the skill set of the workforce. These skill gaps contribute to the data gaps. The inability to collect quality data contributes to poor functionality and a systems gap. But despite that, there are some examples of success. Physiotherapists are expert innovators, so they always find a way. The SNAP is a UK-wide comprehensive data audit covering stroke care. It is hosted out of King's College in London, with stroke services not being mandated to collect. They want to contribute data to it because they get excellent intelligence back from it. It allows appropriate comparison with other stroke services, and of course, there is gentle competition between services for data compliance. Data is collected from hospital admission to 6 months after stroke, with data based on the national guidelines for stroke care, including scanning and diagnosis, admission and hospital care, prevention information, patient and carer education, rehabilitation compliance, and other lifestyle factors. All 4 nations across the UK have digital and data capability frameworks to support the workforce in achieving the bold policy and strategy ambitions. Notably, only one of those, published by NHS England, has been specific to AHPs. And the CSP have developed an online education program called Digital and Data Foundations, or the DDF, which has been led by the CSP, but developed in collaboration with other professions to improve the digital and data competence and confidence of all AHPs in the UK. We developed it specifically for AHPs and tested it with AHPs. It is freely accessible to all AHPs across the UK, regardless of their geographical location, employment, profession, or career stage, and it can be accessed right now on the NHS England Digital Academy. We are working with the other countries in the UK to host versions on the learning platforms that they are more familiar with. This is part of a wider evaluation and implementation work that we're doing in 2026 and 2027. We hope that this can address some of the skills shortages identified by Tak et al. In 2022 and equip our AHPs to improve the quality of their data and use it to improve the quality of the systems that they use. We can turn the gaps we identified into opportunities to enable our services. This can give us a fighting chance to achieving the bold ambitions set for us in policy and strategy. I now want to talk about federated data. IBM defines federated data as a type of metadatabase bringing together multiple data sources into a single data source. This is what the EHDS is trying to do. Bring multiple data sources from across the EU into a single space, and it is an incredibly complex process. I already mentioned the 10-year plan for the NHS in England. Delivering the Federated Data Platform, or FDP, is one of the key items of that plan, with work beginning in 2023 ahead of the launch of the 10-year plan. The core contract for the FDP is around £330 million to Palantir, with wider programme costs across the life of the programme expected to be over £1 billion. Similar attempts to deliver standardised care has already been tried a number of times in the UK. There was the National Programme for IT in 2002, Care.Data in 2013, and the General Practice Data for Planning and Research, or the GPDPR, in 2021. All have failed, with multiple lessons appearing. Those include poor communication, opt-out concerns, trust issues, and workforce resistance. Health data is increasingly complex, so finding a single platform solution for this becomes increasingly complex too. The FDP launched in 2023 ahead of the 10-year plan, with the national policy direction and competency frameworks all supporting the journey. Our own DDF is also there to address competence gaps. However, the FDP has already hit significant challenge. Politically, there are concerns over the contractor and the huge expense already. Those are echoed with safety concerns around privacy, public trust, vendor lock-in, value realization, and workforce buy-in. Without addressing these ahead of procurement and implementation of the EHDS, this will inevitably lead to friction and likely to failure. I said that health data is complex. Physiotherapy data on its own is very complex. There are many sources, types, outputs, and challenges of physiotherapy data. To simplify this across multiple specialties and different sectors for physiotherapy is incredibly difficult. And that's just for our profession. We've tried that using the Community Services dataset in England or AHP operational measures in Scotland, but again, neither have been successful. Then there are all the other professions involved in healthcare, and the complexity begins to grow exponentially. Then there are all the other countries. We all practice physiotherapy in slightly different ways. Our health and care services are governed and delivered in different ways. Our cultures and belief systems are different too. Health is a massively complex sector, and so the data is complex too. The data is rarely complete, so we need to anticipate that data void. I fully support moving towards federated data, as long as the process includes all stakeholders and suitable consideration is given to all the factors affecting success. I want federated data to be successful. I'm just trying to be very realistic on the challenges that are in front of us. The technical challenges of federated data across Europe, data standardization, data sharing, etc., are actually the easy bits to fix. The challenges around culture and trust, both public and within health professionals, and changing the processes and procedures that we are used to is far more complex, but must be overcome if we are to achieve success. I applaud the European Region Working Group for their work towards a European framework for digital competency. It will definitely support the profession towards improving our culture around digital and data, and give us a chance to give the solid start to achieving the challenging goal of European federated data. It is vital that we equip the workforce with these skills. Understanding the gap and supporting the workforce will give us a chance of success. It is extremely complex, but those are two parts under our control. If we can address them, then we might have a chance in achieving federated data. The UK hasn't got it right yet, despite many attempts and lots of money being spent. If the EU is to achieve this through the EHDS, then it could do with learning from the mistakes already made in the UK. Thanks very much for the opportunity to share what is happening with physiotherapy data in the UK. We have a number of challenges, some areas of innovative success, but still much to do to achieve our ambitions. We hope that we can contribute to European work to improve the quality and quantity of physiotherapy data. And if we can achieve that, then it gives the EU a much better chance of success in delivering the EHDS with physiotherapy included as part of it. I look forward to hearing from you all and contributing along with my colleague Jackie to the discussion this morning. Thank you.
Thank you, Euan. I think now it's the time to open the floor for all of you to pose your questions to the presenters before moving on to a more structured discussion. Let's take this opportunity to learn a little bit more from these two very good examples. So please go ahead.
Thank you, and thank you to both speakers, Martin and Euan, for fantastic insights into what's going on in your respective countries. It's very impressive, and I think we've a long way to go. I just wanted to ask Euan, in terms of supporting the European federated data and issues around trust. So even within the physiotherapy community, do you think that we in the European region can do something? I'm very conscious of how much work has been done by the Advocacy and EU Matters Working Group and the group led by Marloes. But is there something we can do as a region in terms of addressing that challenge and the lack of trust? Is there any way we can help?
Yes. So
good.
I'm fighting a dangerous space to expect or to assume that the physiotherapy profession in the UK have the same thoughts, belief systems, cultures, and values across the UK, across the EU. But I don't think we'll be that different. So I suspect that physiotherapists all across Europe and probably the world joined our profession because they wanted to help people, not to collect information and to enter it into a system. So it's probably not a natural space for us as a profession. So I would expect that there will be people who would be very comfortable in submitting data and using it to drive, improve, and demonstrate value for their services. But there will be lots of people for who that is a lot less comfortable and potentially even quite a scary space. So understanding what the digital and data competence is of our profession is an excellent starting point. You know, the work that Chris Tack, who is a physiotherapist by background, and the study that he and myself and others did in 2022 was an excellent starting point. We redid that survey last year. I'm currently analysing that data, so expect that to come out quite soon. And that gives us a better understanding of where our profession is right now. The 2022 survey fed into the programme that we developed to educate and to fill those competence and confidence gaps. And that's something that's within our control as a profession. Of course, like Marijn says, we need to be involved in the process with our health ministries, you know, with the EU working group to try and make sure that the systems meet our needs and meet our demands. But that, like Marijn says, it's an extremely difficult process to be really involved in because everybody wants their piece. I suggest that we as a profession need to understand where we're at, improve the competence and confidence of our workforce, as well as contributing to that process. And And if we manage to do those things, we've got a chance of success. But it's really complex.
If I may add, we're actively looking for advocates or examples, good examples of physiotherapists working and registering data and using their data to improve their healthcare. And if we're talking about trust and knowing what's done with your data, it helps to see some colleagues who have good experiences with this. So there are often front runners which you like to set in the spotlight, make some videos of people using our quality improvement database. So small steps in trying to gain trust in using data, registering patient information the right way.
Yeah, thank you. And perhaps people who are here today who do have that type of experience could put their name and contact detail in the chat, and then that would be great, because I'm sure some of you are here with experience and some of you are here with no experience. So perhaps those who have experience would be willing to contribute even to further discussions. That would be great. Thank you very much to both of you.
I will just ask something, not ask actually, it's like more a reflection. So sometimes we look into countries like the UK as a good example to follow. And today in my perspective, you raised the awareness of something that is very important, because sometimes we are concerned about the systems, but we forget about the capabilities of the workforce. And you just highlighted how important it is to understand if physiotherapists are ready to use digital tools before doing or working on digital records. And I want to ask Marijn if he has any experience on this point on the Netherlands. Have you tried to assess something similar? What are your experiences at this point regarding the digital literacy and data literacy of the workforce?
That's a good question. Of course, not every physiotherapist is very familiar, very experienced with using the data, digital literacy. There are big differences within the physiotherapy, and I think there's an opportunity to help our members, to help the physiotherapists improve. There were some research on this in the Netherlands, not in physiotherapists, but I think it's very useful also for us. That about 30% of healthcare practitioners are illiterate and have perhaps take much more time in basic things like email use or other digital working steps, I'd say. So I think it might be an indicator that many people we can help a lot of physiotherapists improve on this. We have some examples. We have 2 e-learning courses for physiotherapists that they can follow, and they are guided through some examples where they can work on using data to improve, using benchmarks, how to use benchmarks, and they get information how their data is used. We hope this will help practitioners, but also the healthcare providers, the physiotherapy practices, training their physiotherapists and improving overall. So perhaps these are starting points for us to help our physiotherapists using their data.
Thank you. I would really love to hear more experiences from the participants in the summit. It would be really helpful to understand a little bit what their realities are. So in your countries, are physiotherapists used to use data in a more structured way? What are the barriers? What are your feelings on this point? I would really love to know a little bit more on this from you. Please don't be shy. Go ahead, share your experiences, because this is all what this summit is about, and it will be much more richer if you share what your views and your experiences are on these points.
Adérito, I can give an example for Belgium, for instance, and I think that this is true across many European countries, is that sharing of information for physiotherapists is actually not made possible because we have standalone physiotherapy files for the patients, which are at this stage not truly connected, at least outside the hospitals and rehabilitation centers, that are not connected to other patient files, for instance, for the GP or for nurses. So although physiotherapists are slowly educated in sharing information, or at least the importance of sharing information, it is just the structure of the collection of healthcare data and how it is stored that it makes for now for physiotherapists almost impossible to access relevant information and to share relevant information. So that's one of the challenges that we are facing in Belgium.
Okay. I believe that may be a common issue in other countries as well. Well, I will not speak on the Portuguese example. We have Antonio here. So Antonio, please, if you want to go ahead and give us your experience on what's happening, for instance, in Portugal on this matter.
Yes, thank you very much. We have the same situation. We are outside of the biggest systems of data gathering and circulation. But I would not stress in this meeting, which I congratulate for its organization. I would stress here the big opportunity for physiotherapists to go in this European project. If we fail to have a step, even a small window or a small step in this process, it will take a very long time to get in this process. So what I feel it is that now we have here an opportunity to put physiotherapy as a regulated profession, as part of the system of information, and we are having this problem in Portugal, and we have here is from our cabinet specific for this project, and she can complement my words. The first thing it is that we need to, as it was stressed here before, to speak a similar language to other professions already established. So we cannot try to impose our thing out of the blue. We need to understand the language that is already within the systems, and so adapt our situation. So in that sense, SNOMED can be a strategic perspective on that. And so I think that we physiotherapists at European level must have an agreement on how can we have a similar language, so we can knock on the doors of our ministries at local level, but speak the same language. If we don't make a social image of unity, and know exactly what we want to be in the records, it will be a problem. So I feel that it will take years, decades for educate our colleagues, and this will be a problem maybe for schools, for a new generation, for specialists, and so on. But from the strategic point of view of the profession, for an organization like the European region, this is the time to make a common voice and have a common purpose, a common proposal to present. We can share our difficulties at the national level with the SNOMED, but if we but that Isa Silva will be more prepared to speak on that if you want some more details, or we can make it in another event or in another perspective. We can start to share our information. But this is our view. It is very strategic to start and do things immediately, so we can be together with the same kind of proposal in all of the countries of the European region. Thank you.
Thank you, Antonio. Well, actually, I would invite Isa to step in as well and share with us these concerns that Antonio mentioned, because I think these will be important for the other members as well.
Hello, good morning, everyone. So delighted to be here in this morning with you. Hope you hear me well. Thank you, Antonio, for the context you gave. It was pretty in, and with the perspective about SNOMED. SNOMED as a clinical terminology, it's a tool that we found, and alongside some government initiatives in the Ministry of Health in Portugal, it was given the opportunity to reunite a group of codes, SNOMED codes, that were appropriate for the physiotherapist action. And the main problem that we found, and the main concern that we have, it was that we started by using the existing codes in the SNOMED International, because that is not a catalog validated for the Portuguese languages as it is for some other countries. In the case of Portugal, that doesn't happen. And alongside other professions, they try to do these exercises also, nutrition and psychology, I believe. And for the physiotherapy, the main problem that we found, it was like, there was not enough codes that we could reflect the whole spectrum of action of the physiotherapist. So in this case, it was the first problem that we found. And the second one was to try to get along with the existing codes that we could use. But if you go to the specificities of each code, it will be very difficult to see the physiotherapist action in those. So the main solution that we tried to go along with was, if there was okay, try to propose new codes fundamenting with evidence, and try to use these codes in the most similar in the most similar way they could reflect the physiotherapy action. It was a complex step, and it's still going on, and we are still in conversations, and I will be very happy to get some more info from the other country. I was so happy to hear that the Netherlands is also using shared language SNOMED in their interoperability systems and health data systems. It was so nice. So I think if we can starting from here, because SNOMED, it's a huge opportunity. It gives it's not a closed system. It's not a closed terminology, and if we all talk in the same way, I think in the long term this will be a much smoother way to get with not only at national level, but also the transferability of data across Europe. I think it's from this way, and I would like to hear if some other country has also experience with shared language terminology. I don't know if the UK they use it in their initiatives. And thank you so much for this moment of reflection.
Thank you, Isa. Well, actually, we last year we shared a survey, we analyzed the data, and we understood that SNOMED was, well, although a few countries use it, it's the most common tool being used in the region. So as Esther Mary is, for instance, pointing in the chat, maybe we could try to advocate for the use of Németh across the region. But well, that may be for future work, but undoubtedly that is something important. Yes, Euan.
Yeah, I just wanted to say I put a few notes in the chat. Just that the CSP have developed some Németh subsets. They are nearly 10 years old now, so do need significant review before they're ready to use. They're not comprehensive, so there will be gaps in those, but perhaps it's a starting point. Németh has been mandated in the UK since 2020, but it's still not that well known about within healthcare services. It would be a smaller number of data-minded people rather than everybody that understands about them. So we have some information pages which I've put a link to in the chat, so our members can have a look at it as well. I suspect that'll be information that is known to many on this call, but it's probably not known by all the members of our organizations. And I think we've got a bit of an education journey ahead of us. A couple of times education has been mentioned, and about the use of digital and data and the introduction of that at university level for our students, which I completely agree with. But we also need to be mindful about the skill level of our educators. So there was work published that our educators weren't all comfortable in terms of teaching digital and data. So we need to be mindful of that, and we need to give them information that they can impart as expert educators to the students. But they're not all, same as clinicians, our educators are not all starting from the same point of digital and data expertise.
Thank you, Euan. Well, I would say that we are in our first round of discussion, and we have 4 questions in the chat that you can use for like a script for your interventions here. So, is your organization aware of the national implementation of the HDS and the timeline being used in your country? How does the organization view the steps needed for physiotherapy in the next 2 years? Can you indicate where your current focus lies on physiotherapy in the area of data federation? And what is your one action that would make the biggest difference in the next 12 months? I think this is a good topic, a good starting point for our discussion. We already heard from Portugal experience. Mariana Duzmovic wrote something in the chat, but I invite her to give us her insights personally. Please, Mariana, if you want to come in, or any other colleague, please just tell us where are you? Where is your country in this process? It really will help us to understand a little bit more on how is the region going on this topic.
Usually about all health data. We not start. Our Ministry of Health is not start speaking about this.
Okay, thank you. Vili, please, if you want to come in as well.
Thank you for the opportunity to contribute. I will briefly share our perspective from Greece. European health data space, we are aware that national legislation is currently under preparation. A relevant law is expected within 2026, led by Ministry of Digital Governance, including the establishment and governance of the data access body. Until then, we need a monitoring phase. Regarding the European health data space, we're aware that national legislation is currently under preparation. So a relevant law is expected within 2026, and led by the Ministry of Digital Governance, including the establishment and governance of the data access body. Until then, we remain in a monitoring phase. And from our perspective, the key step for physiotherapy is to actively engage on the national framework becomes available. So our organization is ready to contribute with professional input and suggestion in order to support the effective integration of physiotherapy within the AHDS framework. At this stage, our focus is on preparing to participate in public consultation, particularly in the open calls for feedback on the implementing acts of the EHDS, so that we can represent the physiotherapy perspective. And at the last, looking at the next 12 months, the most important action will be the adoption of national legislation for the transitional period, especially regarding the secondary use of health data. This will be essential for a smoother transition towards full implementation. And finally, we believe that the European region can play an important role for supporting the development of infrastructure, facilitating knowledge exchange between countries, and providing guidance for consistent implementation of IHDS service across Europe.
Yes, Philip, thank you so much for your intervention. Vladan, you were trying to come in before, so please go ahead now.
Yes, I'm here. In Czech Republic, our Ministry of Health wants to implement the standards and electronic documentation central for the patients. We have a e-recept and other at this time is obligatory, but after this next year, this maybe will be obligatory for every user, every profession. But at now we have a little of information about it, and we don't have information for our members how to implement it. And it's mostly the main problem for in Czech Republic.
Yeah, it's a common issue in Europe, it seems. Well, Agnes, from Austria, can you please share your experience as well? You wrote something in the chat, but it would be really helpful if you could share it with us. Yeah,
hello, nice to be part of the meeting of today. To make it quite short at the point, in Austria it's the case that the health data, there is a system which has been rolled out some years before, which means that health data are shared, but only between professionals, means practitioners, not physiotherapists. They are not yet included. And the health data are not yet shared by all professional groups of professionalists working with patients in the health systems, but only yet by practitioners and by bigger health institutions, which has formerly a quite logical sense or root of this system, because there is the need, evidently there is the need to be sure and to take care of the safety and to registrate people and institutions which have the access. And it's not longer than 2018 that physiotherapists in Austria has been first registered. So there's for sure a connection between official registration and the possibility to identify person or institution and the access to these data to be part of sharing and looking into them and exchanging. So now the possibility already for years is already there, but we are not yet included in the group of professionalists that can share. Not yet there is a plan or there's a fixed data when this will happen. And on the EU of the level of the European legislation, it's noted quite well, not very defined. That's clear, because there have to be national laws to make all the decisions and all the details. But as often in Austria, we wait for the details, and I suppose that it's about the money, and it's about the question how many and who has to pay for the accessibility and for running the systems on the level of the professionalists. The doctors have already made their point, and they are already have they can be sure that it will be partly paid. But for now, we have no concrete informations if and at which time and in which way physiotherapists will take part of it. And maybe we see it at the secondary data. There are exceptions. So not the data used and looked inside for the patients, but the secondary data used. There are exceptions, which are also okay for our professionals, because small groups of people or unique physiotherapists are not asked to work into it, which has also its positive things as points. But maybe I'm waiting for the exceptions. We will see what the national law will bring to us. But it's a big opportunity for sure. But it's always the question how to argue that it would be important for the group. And I suppose also it's a question how to argue. And thanks a lot to Scotland for the free speech. It's a question to argue also to the physiotherapists that there is that it's positive, that it brings positive input to everyday's work to have these data and to exchange these data. Thanks.
Thank you, Agnes, for your points. Claudio.
Hi, everybody. Thank you for the opportunity to share our experience. Maybe my colleague Simone may add some details after me. For the Italian context, we can say that national implementation of AHDS is closely linked to development of our electronic health record, and in Italian, fascicolo sanitario elettronico. The country has already required clinical documents to be structured according to HL7 CDA release standard, and will be is well established for medical and diagnostic reports. So specialist reports, laboratory results, and imaging, and so on. In particular inside NHS facilities, and also for the accredited private facilities with the collaborating with the NHS. It's less represented in the pure private sector. The national roadmap actually is broadly aligned with the European timelines, and it's strengthening its infrastructure, and data availability is expected for the end of this year. And the Ministry of Health planned, hopefully, to gain full interoperability, also a cross-border exchange by 2028, hopefully, I mean. And however, the situation for physiotherapy in is significantly different, I think, because it's inside the translational phase. And so, although physiotherapists are formally recognized as professionals who are required to contribute to the national electronic health record, currently there are no specific physiotherapy documents defined within the official dataset. And as a result, physiotherapists do not yet routinely produce these documents in interoperable formats, unlike other healthcare professionals already do it. The Ministry of Health recently announced that a specific decree is currently under development to define this context for physiotherapy and for other professionals that are not currently providing documentation. And as a physiotherapy community, we will be surely active to ensure that physiotherapy is appropriately represented. I think that the most important point of focus in the near future is to be present in this situation and to ensure that physiotherapy can meaningfully participate in the emerging ecosystem. And I also add that recently, consulting with other colleagues into webinars and other contexts with our community, mainly in Northern Italy, for example, a critical issue has been proposed by the colleagues, that is the increase in administrative workload. So this I think highlights the need for systems that are user-friendly and well integrated in clinical workflows, and we have to discuss it with our ministry and our regional authorities that will be in charge for the development of this informatic infrastructure. Thanks.
Thank you, Claudio. Simone, do you want to come in and add something?
Hi, everyone. Well, no. Claudio has covered most everything. I think that is essential for us to define a core data set at least. And I was wondering how the UK and the Netherlands had reached that step and who helped them to define the core data to put in. And also I think that is essential to understand then the purpose that each country will have where the data are analyzed. And this is also to ensure trustness in those who input data and in those who read the data. I am one of the statisticians of the largest EMA-approved patient registry, which is the Cystic Fibrosis Patient Registry. So I know very well what inputting data and working with data means. And one of my worries now is to understand not only the definition of the core data set, but also the validity of the data. So what action should we implement to assess the validity of what has been inputted? And if we need to think about like validation visit within the national environment. So many questions, maybe no answer at all at this stage, but this is extremely important. And of course, as an Italian association, we are happy to help and join the challenge.
Thank you, Simone. Well, we have moved from diagnosis to more specific action suggestions, and we are now in the final part of our summit, and we will move to the, well, let's say the key takeaways and next steps that we were considering and listening to all of you. And I think everything that was mentioned may be covered in this point. Before closing, we would like to summarize the key takeaways and next steps from today's exchange. The main message seems to be clear. Physiotherapy cannot remain a peripheral component in the development of digital health data systems. The HDS will influence how health data is assessed, documented, exchanged, reused, even for secondary use, and governed. Our survey that we did last year shows that member organizations are starting from very different positions and different points, as we saw today as well from your testimonials, with uneven access to digital records, limited standardization, and very important legal and technical and financial barriers. So the next steps need to work at two levels: actions for member organizations nationally, and eventually coordinated action from the Europe region. So if we are considering points for member organizations, we think that track nationally HDS implementation is important. So member organizations should actively track how the HDS is being implemented in progressing in their own country. This is not only about monitoring legislation. It's actually about identifying where decisions are being made and advocate for physiotherapy to be represented there when possible. These decisions will affect access rights, professional workflows, electronic health records requirements, patient summaries, and secondary use of data. If we are not involved early, implementation may be more difficult and move forward without reflecting our professional needs. Second, member organizations should assess the readiness of the workforce and current digital record systems. These mean asking basic but important questions. Are physiotherapists using official digital records? Are physiotherapists ready to use them? Are these systems interoperable? Do they connect with wider health data infrastructure? Are private practices included, or only public and hospital settings are being considered? So the first step in many countries may not be upgrading the systems, but trying to map the current situation and engaging with vendors, regulators, and digital health agencies and service providers. Third, member organizations should review which terminology, coding, and interoperability standards are being used nationally. We talked a lot about Németh today. There are other options, but probably Németh is the most common and what is being more used widely in the region. The key issue is not only whether standardization exists or not, but whether they are able to capture physiotherapy relevant content, and Németh is able to do this, at least from your feedback. Fourth, member organizations should support physiotherapy practices with practical guidance. The HDS strengthens the citizens' control of their health data and introduces important expectations around access, restrictions, transparency, and data use. Physiotherapists will need to understand what patients can access, what they can restrict, how opt-outs may work when relevant and when we have more information about this, and what professional responsibilities apply when assessing or sharing data. This guidance should be practical, but not legal, but not with terminology that is too complex to understand. Fifth, member organizations should explore the implications and opportunities of secondary use. I know that if we are able to deal with primary use of data, that will be great, but considering the implications and opportunities of the secondary use is also very important, because this will work towards our autonomy and professional development. If not, it can work against us. On the other side, when we are talking about the role of the European region, we should try at least to explore whether we can coordinate a common physiotherapy terminology and semantic strategy. This does not mean imposing a system in every country, but at least trying to organize forums like this one to allow peer exchange and peer learning. It will be very hard if each one of us try to develop their own systems with their own terminology. it will be very hard to implement something that tries to be more uniform. So I think this is an important aspect of what should be next. Second, the region can support the development of a minimum physiotherapy data set. We talked about this today as well. This should focus on small, feasible set of data elements that are meaningful across countries. Our previous survey already points to strong agreement around diagnosis, treatment goals, interventions, outcomes, functional status, and others. A minimum data set would help make physiotherapy more visible in health systems. It would also support benchmarking, quality monitoring, research, and advocacy. Third, the Europe region can support the development of a shared physiotherapy patient summary template. The aim should be a concise, clinical, useful template that can support referral, discharge, continuity of care, patient access, and cross-sector communication. This should be adaptable to national contexts, but it should include a common core. Fourth, the Europe region has an important advocacy role at the European level. Physiotherapy requirements need to be visible in the HDS implementation, digital health programs, and related policy discussions. In our previous webinar, we had someone from the EU Commission to talk in that webinar, and he told us that he was not aware that physiotherapists were actually concerned about this topic. So this was great, because at least we introduced ourselves and we said, we are here and we need to move on the same train as the other healthcare professions. Fifth, the Europe region should advocate for funding and support mechanisms. Implementation will not be cost neutral, as Agnes was telling. It's all about the money. It's something that we need to be aware. Implementation will need to rely on smaller private sector providers and countries with less mature digital infrastructure. So this situation will face great barriers, or bigger barriers. We already highlight that in our survey as well. So funding advocacy should focus on interoperability, digital readiness, workforce training, training the trainers, implementation support, and inclusion of physiotherapy across both public and private settings. So to close, I would frame the next steps in one sentence, or at least I will try. Physiotherapy needs to move from fragmented digital readiness to a coordinated professional visibility in health data systems. For member organizations, the priority is to engage nationally, assess readiness, not only of systems, but also of the workforce, support practices, and prepare for primary and secondary use of data, especially for primary use of data, because in the short term, that is the most important points. For the Europe region, the priority is to explore the possibility to coordinate what should be solved, what should not be solved country by country. So terminology, minimum data set, patient summary, European advocacy, and implementation support. The HDS should not be seen only as a regulatory challenge. It must be seen as an opportunity to strengthen the continuity of care, professional recognition, evidence generation, and the visibility of physiotherapy across European health systems. So this is an opportunity, but we have to take on the lead on the process. Thank you. So Marlos, I will give the word to you now.
Yes, thank you so much. Thank you, Tim and Adérito and Marijn and Euan, for the information and for all the countries that contribute and give your thoughts. It's very nice to hear from you. And Marijn suggested to make a list of contact persons. Maybe we can contact you after the summit to ask if your country has a contact person, so we can share information and ask questions to each other. But for now, thank you very much. And I think we should stay in touch with this topic. Thank you.
I want to reiterate that. So thank you all for being here. Thank you for sharing. And let's keep in touch, and looking forward to seeing you in the realms of the Europe region in the future.